Update on the COVID-19 situation across the state of Maine for today, Thursday, July 16th, 2020. I'd like to start by providing an update on the epidemiological numbers before I turn to some updates on the outbreak front as well as some of our data. As of this morning, there are 3,598 cases of COVID-19 in the state, an increase of 20 cases since yesterday. Of those cases, 3,207 are confirmed and 391 are probable. There have been 114 individuals who have passed away with COVID-19 across the state, and 374 people have been hospitalized at some point. Right now in the state of Maine, there are 13 people who are currently hospitalized, 11 of whom are in the ICU and 4 of whom are on ventilators. Overall, 3,094 individuals have recovered. And of our cases, 844 are among healthcare workers. I'd like to provide an update on some new and pending outbreaks that Maine CDC is working on and working with. The first is an outbreak investigation that we just opened this morning at the American Roots manufacturing facility in Portland, where there are a total right now of 11 cases of COVID-19 among employees of that facility. After receiving test results last night indicating that there may be transmission occurring within the facility, Maine CDC this morning opened an outbreak investigation. Now, one very important note from a data perspective, the 11 cases that we have recorded at American Roots are not reflected in today's numbers. Those cases crossed over our laboratory reporting system after the cutoff. They will be reflected in tomorrow's numbers, but they are not in today's numbers. But in the interest of transparency, I'd like to talk about this outbreak today rather than on Tuesday. We've been working very, very closely with the leadership and management of American Roots. And in workplace outbreaks, our investigation focuses on 3 things. The first is working with the facility to conduct serial rounds of testing of all individuals for COVID-19. The management of American Roots has already undertaken 1 round of serial universal testing, and they have another round of testing planned for next Tuesday. The second element of our workplace investigation protocol focuses on contact tracing. Working with American Roots, we have already completed a preliminary contact trace of the employees, as well as the nature of any interactions that they may have had within the workplace itself. The third element of our work in these situations focuses on providing needed social supports. There are already resources in place for those who may need support during the period of their own isolation and quarantine. The fundamental epidemiological question in any workplace setting outbreak is whether the individuals contracted COVID-19 at the worksite or whether they may have had other outside external contact where they may have contracted COVID-19. That's the single most important question in any workplace outbreak. And that's the question we're seeking to answer right now, working with our colleagues at American Roots. I'd like to commend the leadership of American Roots for being proactive in their approach to this situation. Even before Maine CDC's outbreak investigation was opened, American Roots, on their own, arranged for universal testing of all their employees. It is because they were proactive sooner rather than later that we now have the information we need to conduct a full investigation and respond to the needs of affected employees and their family. We're going to be continuing to work with our colleagues at American Roots over the coming days and weeks. The facility has now 3 times, now for the 3rd time, idled all production at the facility to conduct a deep cleaning. We've helped them communicate with their staff about what's going on and what the nature of Maine CDC's investigation will be. And again, we will be continuing to work with them as our investigation takes shape and we start answering some of these fundamental questions. I'd next like to provide an update, I have two subsequent other outbreaks that I'd like to provide a note on that we've also opened up investigations into. The first is at Corsetti's restaurant in Westbrook, where Maine CDC recently recorded 3 cases among staff members. The management of Corsetti's similarly has voluntarily closed that location for 14 days, and Maine CDC has recommended that all employees be tested. The third outbreak I'd like to report on this morning is one that we've recently opened this morning at the Goodwill Distribution Warehouse in Gora, where there are also 3 cases. That facility too has temporarily closed in order to allow for deep cleaning, and we will continue to work with them to answer this fundamental question of where transmission may have occurred. And finally, a quick update on a pending outbreak at the Cumberland County Jail. Our outbreak investigation there continues. One of the elements of that investigation is conducting serial rounds of retesting. We're working with the sheriff and staff and leadership at the jail to make sure that testing gets done. And we analyze the results to try to figure out how COVID may have been introduced and what types of infection control practices we can work with the jail on to keep it out. I'd like to next turn to address an issue that's certainly been raised with us here at Maine CDC and has been a frequent topic of conversation at the national level. And that's with respect to the way in which hospitals, as well as Maine CDC, report data. Many of you are aware that the federal government recently changed the manner in which certain data from hospitals are reported back up to the federal government. Previously, hospitals reported those data to a portal via Maine CDC, and we, in turn, reported them to the federal government. But based on a change that was enacted yesterday by the federal government, hospitals are now asked to report those data directly to the federal government. I want to be clear about a couple of things. The first is that this is not all the data. Maine CDC continues to receive and report hospital resource information that are the most critical to our response. These are the same data that we have been updating since the earliest days of the pandemic, putting on our website, and for me to report to you each and every time I'm with you. These are things like the number of ICU beds, the number of ventilators, the number of individuals who are currently in the hospital, and the number of individuals with COVID-19 who are currently on ventilators. That aspect of our data reporting and collection has not changed. What's also not changed is the data that appear on our website, such as the number of individuals with COVID-19, the number of tests that we are conducting, the distribution of cases throughout the state. Those data, the epidemiological data on our website, are not affected by this change and thus will not change. Nevertheless, we have heard from hospitals that this change in reporting requirements presents a challenge to them. We are working with hospitals across the state to meet the new challenge that they face as a result of these changes at the federal level. As soon as this announcement was made by the federal government on Tuesday, our head of emergency communications reached out and spoke with his counterparts at Maine hospitals to get their take on what this change would mean to them. We continue to work with those same hospitals. What we heard and what we have heard is that this change for the hospitals presents a challenge. Frankly, any change in any operational tempo in the midst of an emergency can be burdensome and disruptive. We understand that and we acknowledge that. Maine CDC has but one goal in these situations: to stand with and support Maine hospitals, who have been important allies to us since day one of our activation. Simply put, our job is to make this work. Toward that end, we are exploring how to reestablish the same reporting system that was previously in place, under which Maine hospitals would continue to report their data to us on a daily basis, and thus we in turn, going back to the previous system, furnishing those data to the federal government. That process is already underway, and we're working with our IT system operators to bring that previous process back online. I want everyone to know three things. The first is that this change will not affect the operation and conduct and the way that we respond to the COVID-19 situation across the state. Number two, this change does not at all, not for a second, alter our commitment to full and complete transparency. This change on the part of the federal government will not affect the manner or the degree to which Maine CDC reports data on hospital utilization. And the third thing is that we remain committed to hospitals in Maine. As I mentioned, they have been some of our strongest allies since day one of our activation, and we pledge to make this work for them. That is our goal. What I've just talked about is around the substance of this change. There are some very important procedural points that I think bear some discussion. The first is that the pace at which this change was announced and enacted was quite fast. And as a result, it did not leave time for proper consultation with states. Instead, it was announced and rolled out within 24 hours. In fact, it was announced during our same meeting on Tuesday at 2 p.m., and it was rolled out and effectuated the next day. Those procedural points are important, both the consultation as well as the rapid rollout. And we're working with the federal government to make sure that when subsequent changes of this nature are announced, they brief states first, get our input, and make sure that input is reflected when they go live with those changes. I'd like to now turn to providing some data on where things stand with respect to testing across the state. Let's start with yesterday's testing data. Based on 2,529 PCR tests reported to Maine CDC yesterday, the one-day point positivity rate was 1.07%. On a 7-day weighted average, that brings our 7-day PCR positivity rate to 1.0%. By reference, there are parts of the country right now where the positivity rates are well into the high 20s and even 30% range. Nationwide, depending on what region you're in, the positivity rate can go from 5 to 10%. Our positivity rate of 1% still leaves room for improvement. And the way that we will improve that is by expanding the volume of testing that we are conducting. Right now in Maine, we are conducting approximately 157 PCR tests for every 100,000 people across the state. Our goal is to expand that even further. The Swab and Send site announcement that Commissioner Lambrou made on Tuesday will certainly help expand the availability of testing across the state. And as a result, we hope not only give more access to testing, but also make sure we have the most full and complete picture of the outbreak as it currently stands. So with that, I would like to turn things over to our colleagues in the media. And today's first question goes to Amy Brown at WERU.
Thank you, Dr. Shah. Just a quick follow-up on the positivity rate. Do the tests that are done for folks who have residents outside of Maine get included in our positivity rate?
Sure. So it depends on where those tests are done. If they're done at the Maine CDC laboratory, they do. So actually, you know what? No, those are the data that we use to calculate positivity rates is actually based on all test results that are reported electronically, regardless of where an individual's residence is. If it's reported electronically to us, that's how we use the positivity rate calculation. So the answer to your question is that yes, it would be reflected.
Okay, thank you. And with talk about schools opening up in the fall, do you think it would be safe at all for schools to be opening in any part of the state without a plan for physical distancing and the kids wearing face coverings?
So there's going to be much more to come on that particular aspect, Amy. But what I will tell you is that Maine CDC has been working very closely with the Department of Education on this exact question. And we have recommended that as we think about getting kids back into school in the fall, that face coverings or face shields, but face coverings preferentially, be a part of that, as well as physical distancing. The goal, of course, is to return to school in the safest manner possible. And what we know based on now several months of scientific data is that face coverings as well as physical distancing are one of the very essential elements of getting kids back into school safely.
Great, thank you.
Mm-hmm. I'm going to turn to Patrick Whittle at the AP next.
Thank you very much. We were talking about the percent positivity rate just a moment ago. I believe the percent positivity rate in Massachusetts and Rhode Island, respectively, is in the neighborhood of 2.5% to 4%. And let's say it still has the travel restrictions on residents from those states. I'm wondering how low those numbers need to go before that could change. And also, any thoughts about the way Election Day went and what it could mean for when the general election comes? Any thoughts about how smoothly it went and if there are any kinks that need to be ironed out to make it safe and efficient?
Sure. Thanks for those questions, Patrick. As to the former, the data that you noted, the 2.5% positivity rate in Massachusetts, the 4% in Rhode Island, those are the data that we have. We use a national tracking website to pull those data, so we have a standard look. And those are the data that we have and the numbers that we have. And our principle when we are evaluating other states is whether any individual from that state is carries the same risk of COVID-19 as would someone from Maine. Basically, if there's more COVID-19 in another state, based on data like positivity rates, prevalence rates, incidence rates, if any one person coming from another state may pose a higher risk than someone from Maine, we'd prefer them to get a test or quarantine in place for 14 days. So I want to be really clear there too, Patrick. The rule is not that individuals from Massachusetts and Rhode Island can't come to Maine. They certainly can, but they've got to abide the same guidelines as do individuals from a number of other states, which is to say either quarantine for 14 days or receive a negative test before they arrive. The basic principle is clear. We want to make sure that anyone coming to Maine doesn't introduce more risk into the state. I think it's also important to note that a number of other states now have taken a page out of our own playbook in Maine and themselves have instituted either 14-day quarantine requirements, or in the case of states like Connecticut, Hawaii, a number of others, they've replicated the same model that we have, which is to say to get a negative test before you go. As to Election Day, Patrick, I haven't heard of any reports of significant issues that raised concern from a public health perspective, overcrowding, a lack of physical distancing. Not saying that they may not have happened. They haven't been reported to us in any systematic fashion, which I think portends good things come the general. I'm going to turn next to Maria Sacchetti at the Washington Post.
Thank you very much for taking these questions, Dr. Shah. So just to get the numbers straight, so it's accurate to say you have more than 3,600 confirmed cases as of right now. Is that right?
No, we have 3,207 confirmed cases and 391 probable cases. Our total case count, when I report the totals, I report both confirmed and probables.
Okay, so more than 3,600 cases then.
3,598, if we're,
But then we add the 11, right, to it, the 11 from American Roots, right?
Sure.
Okay. And then,
yeah.
Thank you. Sorry, I don't mean to be persnickety, but I just want to make sure get it right. So in the racial ethnic breakdown, does that change as well? I think the last I see is you have 826 African Americans or Black people who have tested or had the coronavirus and other breakdowns. Are you going to update that soon, or is that the most recent information you have?
We update those data usually on a weekly basis. I think we've updated them this week, and we usually update them once a week.
Okay, so and just one last question, please. So I understand you've been hiring more contact tracers who speak other languages, and I was told that one of the recent outbreaks that worked, that people have been getting information in other languages. But in the beginning, immigrant groups, as you know, had said that the state was slow to provide that information, testing information in other languages. Why do you think? Do you agree with that characterization? And why do you think that was?
I don't know that I completely agree. Since the earliest days of the outbreak, we tried to make sure that information around the virus itself, the nature of what can happen, how it's transmitted, where individuals can access testing, we tried to make sure that when we put materials on our website, particularly PDFs and patient page information, they were translated into as many of the languages that are spoken in Maine as possible. I was involved with one of the translations myself into Cambodian, or to help members of that community get a sense of what was going on. So I think those pieces of information are foundational. We've also made sure that the app, the IT system that we use for contact tracing is available in as many of the languages that are spoken in Maine. Just yesterday, we announced, we released it not just in some of the existing languages, but also in Somali and French as well. So in terms of the individuals who are conducting the contact tracing as well, we've tried to make sure that we have individuals on staff who can either speak those languages or, in the alternate, make sure we have on-call translators who can help us navigate those discussions. So certainly we're trying to make strides to make sure that contact tracing occurs in a language that's familiar to those who we're working with, as well as in a cultural background that allows people to interact with it. Could we have done more sooner? That's always the case in any outbreak situation. But we did start the process recognizing that materials and information would need to be provided in as many languages as possible from day one.
Thank you.
Yep. Thank you, Maria. I'm going to turn next to Joe at ABC 7.
Thank you, Dr. Shah. Question I have for you is, with schools reopening in the fall, administrators are expected to hear more from the state in the coming weeks. But my question to you is, if a child is to contract the disease, is the CDC going to have a plan for every school, or is it going to be individualized based on where they are and what they stand? And along with that question, what should we expect in schools in the particular areas where they have more cases than others?
Sure. So, Joe, I want to make sure I answer your question directly. You're asking about in situations where a child within a school may test positive, right?
Yes.
Okay. So, the reason I clarified is that we are working closely with the Department of Education to produce a more general approach toward how schools can safely reopen. Schools themselves will have to take a look at that and then implement that. But with respect to a single case or multiple cases of COVID-19, what we do in situations like that from the public health perspective is, in a way, not substantially different from the way that we work with workplaces or healthcare facilities when they experience cases, which is to say, we take a look at the facts on the ground and we tailor our response plan based on what's going on the ground. Schools themselves should have the basics of a plan in place for what they would do and how they would communicate with, say, parents and staff if they were to detect a case, and how they would rapidly move toward isolating particular students, things of that nature. What we're also working on at the Maine CDC level is ensuring that we have a close set of dialogue or contacts with individuals at the Department of Education who can serve as liaisons between Maine CDC and the schools themselves. For the public health aspects of when there may be a positive case, Maine CDC would be deeply involved in that. But the things that would need to be done in preparation for that situation, like communications, that's something we're going to be working with the schools to have them take the lead on.
Thank you.
Mm-hmm. I'd like to turn next to Ashley Blackford at WAGM. Ashley? We'll come back to Ashley in a moment while we turn to Jay Mishkin at GME.
Thank you very much. Got just two questions for you that come from our viewers. The first one is about people in nursing homes and assisted facilities. Wants to know when you think it's going to be safe for families to be able to visit their loved ones in these facilities.
Sure. So, Jay, right now, outdoor visitation is something that we have felt is safe. As we think about these questions, our fundamental goal is to make sure that we don't inadvertently introduce COVID-19 into a facility. We've seen what can happen when that's done. Now, we recognize that this decision is not made in isolation and that type of social interaction, that family interaction is vital to ensuring not just emotional well-being, but physical well-being, because family members can often act as advocates. Right now, based on the data as we know them, outdoor visitation seems to be significantly safer than indoor visitation. So then the question is, when can we move toward indoor visitation? And it's difficult to speculate, but the things that we would need to have in place would be, for example, a sense that the overall level of COVID-19, the background rate of COVID-19 in the community, were low enough that there is not a new risk or an appreciably higher risk that a family member might introduce it in the facility. When that might happen, to be totally candid with everyone, is very difficult to predict. We have to weigh that against the possible harmful effects of having an outbreak occur. We've all seen what can happen just in Maine when COVID-19 gets introduced into long-term care or assisted living facilities. So when in-person visitation will be able to be resumed, difficult to speculate. But outdoor visitation, so long as folks have face coverings on and are staying 6 feet away, we know that that is a much lower risk, and that is something we recommend that folks do right now.
Okay, one quick follow-up to the schools question that you've answered a couple times. Obviously, the situation can change, and I know we're talking about recommending some distance learning, some distancing and face coverings. But is there a certain level of safety and conditions that the state will be looking at to keep schools open? I mean, things can still go wrong as they have in other parts of the country.
Sure. So Jay, what I'll say is two things. We think about this question in two ways. The first is, what metrics holistically should we be looking at to potentially assess the safety of having children congregating back in school? That's question number one. Question number two is, how often should we be looking at those metrics and thinking about determinations? Let's talk about the first one. There, we, again, as we are with other states, and when they can come here without getting a negative test, we're not just looking at a single metric. We're looking at a number of metrics. And we're going to do the same thing with respect to schools. It won't be one number that's determinative of whether a school or a district is safe or unsafe. It will be a variety of numbers. Secondly, the question is, on what frequency should we be taking a look at those numbers? If you look at the numbers every day, or let's just be extreme, let's say we looked at the numbers every hour, you get into a situation where, because in many parts of the state, our baseline numbers are low, you can actually end up whipsawing from policy position to policy position on a day-to-day basis. That introduces a tremendous amount of instability in classroom education. So we're trying to figure out what the periodicity is, the frequency with which it's best to look at these numbers holistically. Perhaps it'll be every week, perhaps it'll be every other week. But that's one of the questions we're trying to consult, and one of the things I'm talking with my counterparts across the country on, from an epidemiological perspective, what's the optimum frequency? But that's how we think about safety just from a public health perspective as it relates to COVID-19. I'm going to turn to Emily Tadlock at WABI.
Hi, Dr. Shah. So my question is, Maine is one of two states where coronavirus cases have continued to kind of decrease over time. What's next? When can we start to increase things? Are we kind of still in a stalemate right now? Are we going to be able to, what's next for us as a state?
Emily, there are massive forest fires, towering infernos burning in many parts of our country right now. Those forest fires, those wildfires could very easily change direction as the wind patterns change, and they could jump the line and find themselves in Maine within a couple of days. So what's next for us is holding that line, trying to make sure that the wildfires that are raging in other parts of the country don't jump that line and find their way to Maine. For that reason, the governor on Tuesday outlined this, and I'd like to take a second to echo it. We are not out of this yet. And in the same way, it would be crazy for a firefighting team to put out 90% of a fire and say, we're done here, time to go home. We cannot let up on our efforts to keep control of COVID-19. The state of Maine, as you noted, has done an exemplary job. Actually, let me be more specific. The people of Maine, all of us, have done an exemplary job keeping a lid on COVID. But that could change if we let up and let down our guard. So what's next for us, from my perspective, is that we keep our feet on the gas. We keep trying to put out the fire. I'm going to run out of metaphors one of these days, but we try to keep the lid on COVID as much as we can. This is not a situation where we want to walk away before the job is done. We've got more work ahead of us, and what's happening in other parts of the country could very well happen here. I implore everyone to please keep it up. The state of Maine, the people of Maine have done nothing short of amazing work keeping a lid on things, but we've got to keep going. The virus may be, the numbers of the virus may look favorable in Maine, but you only need to watch TV for 30 seconds to see that that is not the case in virtually every part of the country. And what we've learned about COVID is that we are all connected. And what is going on in the Southwest or the deep Southeast could find its way to our front steps very quickly. So in my book, what's next for us is keeping our feet on the gas.
So then I think my next question really is, a lot of us who don't have a CDC brain like you do are breathing a sigh of relief. But you obviously are seeing this from a different perspective. So what is your biggest concern right now?
Sure. So, Emily, last night I was on a pretty long phone call with my counterparts from across the country, including my counterparts in states like Texas and others where those wildfires are raging. And to be blunt with you, what concerns me the most is that what is happening there in all facets could happen here. What's happening in those states is that the demand for testing is starting to outstrip the supply, leading to turnaround times of 6, 7, 8, 9 days. What's starting to happen in those states, as everyone has probably seen, is that ICUs are full. Regular hospital beds are starting to become a premium. And as a result of that, staff are becoming more and more affected by COVID-19, which means that staffing challenges are becoming a problem. PPE is becoming at a premium in many parts of the country. All of that has ripple effects throughout the states. As perhaps many have seen, death rates in parts of this country, such as the South, the West, and the Southeast, are starting to correspondingly increase. As scary as those scenarios are, there is a possibility, a risk that they could happen here, and that right now is my top concern.
Thank you.
Thank you. I'd like to turn to Charlie at the BDN.
Yep. Hi, Dr. Shah. Thank you for taking my questions. Both of my questions are about the change in the federal government's process for taking in COVID data. The first one is just to clarify or make sure I kind of heard you right. You mentioned that Maine CDC is working to restore the system for hospitals to submit their data directly to Maine CDC, and then from there it go up to Maine CDC, send it to the feds. Currently, with the new system, our hospital is basically sending it to two different places, Maine CDC and the new federal system as well.
Charlie, yes and no. So here's to go into a bit more about it, about this is, and we can get you follow-up answers if you need them. Right now, every morning, hospitals fill out two polls that are furnished by the government generally, state and federal. Previously, they were both furnished by Maine CDC. The two polls are, one is specific to Maine CDC, and those are the data that are on our website, ICU beds, total number of people hospitalized, et cetera. The other poll is the poll that the federal government implemented a couple of months ago. That poll has additional data fields that the federal government uses, for example, to allocate remdesivir. For that deeper poll, the second one I mentioned, previously hospitals reported that via a Maine CDC request. Now, for the time being, it's going directly to the federal government. That's the one we're working to bring back in-house with our IT system operator. But I want to make one important point, though, Charlie. Even though those data are being directly reported to the federal government, Maine CDC still has access to them. We can log in to the website that we have access to and check on those anytime we wanted to. So even at the point before we get our old system back online, and we're working with the vendor to see how long that might take, but even before that happens, we can still get access to those data. We haven't been frozen out.
Okay, you actually answered my second question, which was whether you still have access to that data. So maybe on another subject, I just wanted to see more generally, we've heard there still continue to be outbreaks in Maine nursing homes, but they haven't seemed to be as large as some of the ones earlier in the pandemic. And I'm just curious, sort of broadly, what improvements you've seen nursing homes making and how they, treat this disease, and whether that's, had any bearing on what we're seeing.
Yep. Thanks for that question, Charlie. I was actually just chatting with debriefing and kind of doing a root cause analysis on this exact issue with some of my team a couple of days ago. We think there are three interrelated things that are going on that have kind of been responsible or helped contribute to this change in what we've seen in the complexion of the outbreak in Maine. The first is more widespread N95 usage. Again, I wouldn't be doing my part if I didn't say that was in large measure because of the work the National Guard has done to fit test now well over 3,000 healthcare workers, particularly healthcare workers in long-term care facilities. So that's an essential piece of it. The N95 masks are particularly good at source control, as well as preventing the healthcare worker from getting COVID-19. So that really introduces a hard block on COVID-19 transmission within a facility. The second thing is much better infection control practices within long-term care facilities. And I'll point to one particular thing, and that is the concept of, or the system called cohorting. Cohorting is the process of taking one or two COVID-19 positive patients and moving them to a part of the facility where they do not interact with the COVID negative patients. As a result of cohorting, the likelihood of 1 or 2 cases turning into 10 or 20 cases goes down quite significantly. The third thing is more widespread testing within nursing facilities, both of staff as well as residents. If you can get a handle on a situation when there's 1 or 2 cases, it stands to reason you can put into place more deep infection control practices and thus prevent it from getting to 20 or 30.
Okay, thank you.
You bet. I'm going to turn to Patty White at Maine Public.
Thanks, Dr. Shah. I just wanted to quickly double check. When you said that you're not frozen out of that data that's being transmitted to the new the new method that data is being transmitted to the federal website. You have access to Maine data. Do you also have access to data in other states?
You know what, Patty? I am not sure of the answer to that question. We will check with our head of emergency communications and let you know ASAP. I'm not sure, and your question has two parts, which is, do we have access to it before, and do we have access to it now? And then I guess three parts, will we have access to it in the future? I'm not sure about the answers to those, and we'll find out and get you the answer.
Okay, great. And then I also have a follow-up to what Emily was asking you about. Can you, what specific things do you think has made Maine an outlier in terms of being just one of two states where cases are decreasing? Like, what specific things are happening here that you think are making that happen?
Yeah, it's interesting, Patty. The conversation I mentioned a moment ago in connection with Charlie's question, that actually was the topic of that meeting, which is let's take stock of what policy and what has gone down in Maine to put us in the favorable position we're in. So and here's where we landed on that, because clearly nursing home transmission is a piece of that. So here's my assessment of how I take stock. The first and the most important piece of this, Patty, is the way in which people in Maine have themselves responded to COVID-19. People in Maine have understood the science, understood the import of what COVID-19 could mean if it arrived here in the way that it is in California, Texas, and Florida right now. And they've taken strong steps to be serious about it. They've physically distanced themselves. They've worn face coverings. They've generally been staying inside and avoiding the likelihood of transmission. Those are borne out by things like the transportation data that we've talked about at previous meetings, things like that. So the bulk of the credit here goes to people in Maine themselves for taking science seriously. The second piece, though, is some of the policies that we've talked about and put into place very early on and have not let up on. The one that I'll just take a quick highlight on is the non-reopening of bars. Many states that are currently experiencing upticks or re-upticks are states in which close congregate settings, like bars, have been allowed to reopen. That's something that we decided to not do. There's other things that I think more generally provide a strong foundation for proper COVID-19 control. Early on, we struck a deal with IDEX that allowed us to not just expand testing, but remove the testing tiers at our state laboratory, tiers that other states still have in place. We've also early on started making sure we ordered PPE well before other states did. That means that we were able to distribute PPE to healthcare workers to reduce the amount of transmission. Those are just two examples of things that we did earlier on to make sure we had a good foundation for disease control. Going forward, expanding testing even more via the mobile lab and the swab and send sites means that we'll be able to stay ahead of the outbreak as much as possible. So something, as you can tell, Patty, I've been thinking a lot about, and those are some of the root causes that my team and I have arrived upon.
Great, thanks.
I'm going to turn to Eric Russell at the Press Herald next. Eric? Okay, we're going to come back to Eric in a second. Oh, you there?
I'm sorry. I had a problem with my microphone.
Not a problem.
So the question that I had to do with, so you never want to see an outbreak anywhere, but I wonder, if you could talk a little bit more about American Roots, and if every time there's an outbreak like this at a workplace, if it's an opportunity to see how good your contact tracing apparatus is and how good your testing ramp up is. Do you kind of look at it as like an opportunity to really, close things up and see if you can really put a lid on these types of outbreaks?
We do, Eric. I'll say two things. The first is that we're getting better every day. The way in which we approach outbreaks today is better than what it was a couple of months ago, and that's a good thing. we're learning from every single outbreak that we go through. And that's what you would want any scientifically based organization to do. The Maine CDC of today is better than the one of yesterday. And I hope the Maine CDC of tomorrow is better than the one of today. Now, with respect to some of the mechanics, yes, we try to do a quick debrief, maybe not a full after action, but a debrief after every outbreak to see what we learned and what we could do better on next time. With specific regard to American roots, what we've learned in previous outbreaks that we put into practice here is working with a healthcare entity that's based down in Portland that has developed a lot of fluency in going into places and doing mass testing events. We've developed a very good relationship with that entity. And so we know that they can go in and get the testing done. And we've got a procedure in place for them to send those specimens to our lab. We basically have a macro that we can push and make sure that we get answers, or we get them in place ASAP, kind of a rapid response team. And that has allowed us in this situation to cut down on the time it would have required to get testing done from what might have been a couple of months ago, 2 days, to in this situation, about 24 hours. So we're getting better every time and trying to look for ways to improve. Now, you asked also about contact tracing. That too is another area that we're always trying to get better at. One of the things that I noted this a moment ago, Eric, and I'll note it again, the software, the IT system we use to manage most of our contact tracing has rolled out additional languages, something that we didn't have on day one, but now that we do have it, we're hoping to make better use of it. Languages like Somali and French that we know are spoken, sort of to the earlier question, we want to be able to interact with people on. So yeah, we're learning something after every single outbreak, whether it's a workplace, healthcare setting, what the situation is, we're getting better and better and better at it. The last piece that I'll mention is the other thing we've learned and developed a finer approach to is with respect to social services and how we can approach individuals to support them during their period of isolation. It's imminently clear now that asking someone who has just been diagnosed with COVID-19 to separate from their family for a period of up to 2 weeks, but not furnish them with food that is appropriate for them isn't going to work. So we've made sure we've built in processes that really try to take care of every need someone might have while they're in that period of safe isolation.
Thank you, Dr. Shah.
You bet. Let me turn right now to Megan.
Thanks for taking my question, Dr. Shah. There are people who, anecdotally or not, have thought that, or have been confirmed with an antibody test, that they've had COVID-19 or they had it perhaps in January or February, according to CDC contact tracers even. Is there any benefit to confirming this information, or is that something that the CDC plans to look into or have the ability to confirm that there were confirmed cases of COVID before our first case in March?
So, Megan, this gets into the difficulty of interpreting what an antibody test really means. And early on, and even to this day, many of the antibody tests that are out there, not all, but many, are not specific to the virus that causes COVID-19. They may be specific to the family of viruses, but not to the precise virus themselves. And so if we get a positive result from one of those tests of questionable value, we don't know whether it means that someone had COVID-19 in February, or if they just had the common cold, which can be caused by a close cousin of the virus that causes COVID-19. The other piece you mentioned, though, Megan, is what would be the value in confirming that? In some instances, there could be value. If the person is a healthcare worker, it might mean that they need not go through the periodic testing that many healthcare workers are getting before they can show up at their job. But for folks who are not healthcare workers, we do have to wonder whether getting another antibody test, for example, would change anything about the way in which we think about COVID-19 here today in the middle of July. So we're evaluating that. a lot depends on whether the tests themselves are getting better and better. If we get to that point where the test is 100%, well, there's no test that's 100%, but extremely accurate, there might be some value in having folks go back. But right now, the test is not there yet. And the last question for today goes to Bob Evans.
Thank you, Dr. Shah. I have two questions. With reports of tourists or vacationers now getting tested at some Maine hospitals, has there been an increase in people from other states being diagnosed here in Maine? In June, we believe the number was in the 80s, but how much has that number increased, and is there a concern with that increase?
Sure, Bob. As I mentioned on Tuesday, that number is now at about 111. We continue to see that many of those individuals are from folks just across the border who live in New Hampshire, who get their health care in the southern part of Maine. But certainly we're concerned about any introduction of the virus, given that now Maine has such low prevalence rates. Anyone that may be coming in could potentially be bringing it. But thus far, based on where we are right now, of all the cases in Maine, of the 3,600 or so, what we've seen in terms of the number of tests that have been done, that have been positive, not people, but tests, it's on the order of about 100. Could that change? It certainly could. And that's why asking folks to stick and abide by the governor's executive order to get tested before they come in and to make sure that that's done is really essential. Before we adjourn for the day, I'd like to go back to Patty White for a second. Patty, folks on my team have been tuning in today, and so I've got an answer for your question. To your question about whether Maine CDC has access to the data in other states, the answer is yes. We have previously had access, and we continue to have access.
Great, thank you.
You bet. And before we adjourn, I'd like to just try to go back to Ashley Blackford at WAGM one last time. Ashley?
Sure.
Ashley, over to you if you're on right now. All right, well, we'll touch base with Ashley to make sure her question gets answered. But in the meantime, I'd like to thank everyone for taking some time out of their afternoon to join us today. I very much appreciate the opportunity to bring everyone up to speed on where things stand with COVID-19 present as well as future. Before we close, I'd like to also, as always, ask everyone to make sure we not let up with our COVID-19 efforts. Talked about this a bit earlier, but each and every one of you across the state of Maine has done exemplary work keeping our state safe. From the bottom of my heart, I thank you for the extraordinary efforts. I want you to know that the sacrifices that you have made over the past several months have not been for nothing. You only need to take a look at the numbers to see what all of us in Maine can do when we focus on a common cause. But we are not out of this yet. We still have a ways to go before our struggle, our grappling with COVID-19 is over. So as always, thank you for all that you've done so far, but my ask is that we keep it up, Maine. So with that, I look forward to catching up with everyone next Tuesday. As always, please be kind and take care of one another. We'll talk again soon.